A distress call has been placed to the Zipline office here at Vupsi. It sounds like a life and death situation warranting immediate action by the men and women here. The team is in a hurry to meet this need to save the patient. Per their protocols, it should not take more than 7 minutes for such a request to be honored.
We have very ambitious time targets where once an order comes in, the longest it has to delay within us is 7 minutes. So we have two sections, the fulfillment area and then the flight ops area. The fulfillment area, our target is to process the package out of here in 3 minutes. The flight ops area also have an ambitious target of doing so within 2 minutes. So after 5 minutes to 7 minutes, the package should actually be on its way to the destination that it's actually supposed to be.
The drugs requested have been taken off the shelf and the refrigerator, and their batch numbers fed into the computer. The packaging begins and checks are made on the improvised parachute attached to the special packaging box. The packaged drugs move from the fulfillment area to the flight off area for it to be flown to the health facility in need of them. All the checks have been done on the destination of the drone. Ghana Civil Aviation Office in Tamale has given the clearance for it to leave.
On the average, we make around 100 deliveries in a day. However, on a very busy day, we are able to fly as many as 150, 152 deliveries actually to health facilities. And also on a very busy day, we can have about 40 to 50 health facilities actually call in a day. So on an average, we have about 70 health facilities to 77 health facilities actually calling within the span of a week for our services.
This drone is on its way to Kubori Health Center in the Mamprugu Mwakduri district of the Northeast region.
Getting into Mamprugu Mwakduri from Tamale, you have to go through Bolga, go to Navrango, go to Sandema from BC before you go to Mamprugu Mwakduri district. And that will take you about 6 hours because the road is not very good. However, with our drones, it is just a 32 minutes flight to these facilities, and then they're able to get the essential medicine that they actually want.
In exactly 30 minutes, we saw the drone in the skies of Kubori. 2 minutes after, the parachute compartment opened for the packaged drugs to drop.
Because their last mile distribution hasn't been done to them, they do not have any stocks in place to cater for their clients, right? So we deliver as little as paracetamol tablets to them, and even as high as program medications like antiretrovirals, their vaccines and blood. Every commodity are being distributed to them solely because they actually do not have any medicines or drugs to treat their patients.
Every day, facilities like the Kubori Health Center rely on the drones to help them save lives of patients who visit them. Emmanuel Awunitia, Principal Physician Assistant, remembers the era prior to this technology.
Most of the time we used to have shortage of medical supplies for not less than 2 to 3 weeks before we normally get our supplies. And most of the times when clients come, there are certain medical products that even when you prescribe it for them, they can't get it within the district to buy unless they go to Waliwali or Sandema or Navrongo where they can get a pharmacy to buy those supplies. And you can imagine an emergency that you will need a medical emergency drug to save a life, that the person have to travel not less than 3 hours to Sandema or Navrongo before they could get those supplies for you to save a life. It used to actually affect us greatly, and actually we used to lose a lot of lives due to these kind of difficulties that we used to face during those days.
And that monthly supply posed a big headache to this facility and the people it serves. From miles and miles away, technology has been able to address this challenge. Just sitting at their Vupsi office, the drones are able to serve about 256 health facilities On a full scale, however, it can serve about 500 health facilities.
As you know, we have 4 centers now supporting parts of the country. They've done supporting currently about 1,000 facilities, and they have delivered more than 2.8 million supplies across these centers.
So we are building gradually and strengthening our health systems, and I believe that equitable distribution of equity healthcare delivery will soon be achieved with some of these interventions. So the drone system is also another, milestone that we have chalked, and it's helping us quite a lot, and we are making strides.
Vice President Dr. Mahamadou Bawumia says these are the reasons the government settled on this technology.
We have a major challenge in Ghana, in many developing countries, and that is the problem of, remote areas. If there is a snake bite and you need snake serum, how long would it take for that to get to you if you don't have a hospital nearby which has the stock? You may even have a hospital nearby and you may not have snake serum. If a woman is about to deliver and needs blood, moving from, maybe islands in Afram Plains, how do you get, the blood supplies when you need to go by canoe and all of that? It becomes very, very difficult. So we have been thinking of how to address these problems. And, we found out about the Zipline technology.
In the Kubori Health Center, all the essential drugs they lacked and worsened cases like maternal health are all things of the past.
Before Zipline, the kind of medicine drugs that we used to lack, and it was actually impacting negatively on our services, used to be drugs like oxytocin that we used to control postpartum hemorrhage after delivery, basic anti-malaria drugs that we used to save malaria cases from deteriorating, and most of the times even it used to also come to a point that we used not to have even basic medical logistics like paracetamol for children, that's a shrub, even at times diazepam, what we use to control convulsions anytime that a child is attacked by convulsion. These are some of the things that we used to like. But now that Zipline services are in the system, what we only need to do is to place a call, or we send a WhatsApp message to order for whatever we need in the next 45 or 30 minutes, and we take delivery of that.
The Vopsi Zipline office is located in the Northeast region. It is one of the regions badly hit by the recent floods. Over 100 communities were cut off and about 11 lives lost. Solomon Boa is the Northeast Regional Minister.
It's like God loves Ghana more than any other country in this world. If we didn't have these drone services in the Northeast region during the peak of the floods, I don't know what would have really happened.
The Vopsi Zipline base appears to be the busiest in the country, though it was commissioned only in September.
The fact that there was a spillage of the Bagre Dam, and then also the torrential rains that have also been occurring around here, has actually cut most of the facilities of access. We have had the instances where regional medical stores isn't able to do their last mile distributions to these facilities, and therefore these facilities have to solely rely on us.
That is where we are flying these drones across northeastern region where the floods affected most. We could send in our vaccines and anti-snake and blood when they needed them.
Almost every day, they have to get this to be able to save people's lives. Whether midnight, whether in the daytime, whether whichever time it is, it was the drone services that was used to save lives.
Looking back, there seems to have been some foresight on our part to leverage on technology. And this is why, I believe that developing countries have more to gain, the upside, using technology than even the developed countries.
As I speak, Ghana has the largest drone service and drone center in the world. And I sit on the Global Vaccines Alliance group, I sit on their board, and they supported partially Zipline with Global Fund, these big donors in health, with WHO. When I go to board meetings, my shoulders are like this, because they haven't seen that sort of initiative and boldness on the part of our president and his vice.
You only need to have a better picture of it when you interview somebody like Dr. Isabella, who is the medical superintendent at the Baptist Medical Center, that needed blood to save a woman's life at midnight. And when she called the Zipline Center, within the next 30 minutes, it was available and this woman's life was saved. Anytime I go to the Baptist Medical Center, Dr. Isabella doesn't talk about anything apart from these drone services.
The team has come to the Baptist Medical Center in Nalerigo, the capital of the Northeast region, to verify the minister's claim. Luckily for us, we meet Dr. Isabella Amese.
We use Zipline for a variety of services. They deliver vaccines to us, they deliver medications we don't currently have in stock, they deliver blood and blood products to us at all times of the day, odd hours of the day. Whenever we make requests, we get deliveries brought to us. Promptly, within an hour, we get our deliveries.
Dr. Isabella Amese confirms what the regional minister told us.
Over here, all we have is usually whole blood. But since Zipline came in, whenever I need fresh frozen plasma, it's delivered to me within the time frame that I need it. So instead of referring patients who have clotting issues to Tamale, I can take care of them right here in the comfort of my hospital with the help of Zipline.
No wonder the whole of this year, the facility has referred less than 5 maternal cases to the Tamale Teaching Hospital. This is a clear departure from the past. Aside the VOPSI base in Wale Wale, the drone services are operational in Omenako in the eastern region, Mampong in Ashanti, and Sefioso in the western region. The Zipline technology has brought health professionals so much relief.
For me in particular, in BMC, being somebody that is heavily relied on, time is a big issue for me. With Zipline, I am able to do as much as I can within the 24-hour time frame. Because we don't have enough doctors, I'm currently the only medical doctor in the facility. We most of the time rely on local doctors to help support me. Sometimes we get those people, other times we don't. And so you can understand that they are calling me here, they are calling me there, and then my time is very valuable. So those days, there are some cases that you feel that you will spend a lot of time on, and at the end of the day, you may not get good results. So those were the cases that eventually we would have to refer. But like I said, now with Zipline, I'm able to get what I need to take care of those patients. And the monitoring is done with the help of the nurses that I have on the ward. And that has really helped me a lot. I feel that their services, I must say, I'm very grateful they came along.
The grace of God, it says that government has been quite far-sighted, because some of the problems and challenges that we have introduced this drone technology to address, some of them many people could not see. In fact, when I was talking about drones, and when the president was talking about drones, we had not really even thought about flooding and what will happen in the case of flooding. People were asking, why don't you have ambulances instead? We said, well, we will have ambulances, but we need this to complement. But if there is a flood, how can an ambulance cross the road? All the roads are not possible. You can have all the ambulances, it wouldn't cross. So we have a mix of instruments that we can use to help the sick, to help the poor.
Stories of the wonders the Vopsi base is performing are not different from the other centers. We decide to visit the Omenako office. From this center, a number of drones have been dispatched to various health centers to deliver those essential drugs needed. Technology has made it possible to even view all these drones in the skies, those on the way to deliver drugs, those that have delivered, and those returning to base. From this base, the drones are able to serve 350 health facilities made up of hospitals, health centers, and CHIPS compounds. Samuel Akufu is the fulfillment operations lead here.
The facilities are located majority in the eastern region, and then we have quite a number of them also in the central region, parts of the central region, and then we have a few also in the Volta region, and then we have some sites that we can also serve in the Greater Accra region, and then we also have Noguchi, which is the standout site that we use for delivering COVID-19 test samples.
Since the start of operations, this center alone has done over 9,000 deliveries, supplying about 59,000 units of medical products.
Because of the unique nature of our operation, we serve as more of like a buffer for the regional medical stores. So they give us part of the stocks, and then once the facility is low on stock or they are completely out of stock, we fill in the gap for them until the RMS does the normal last mile delivery for them. So there's never really a time where facilities will have to be concerned about running out of a product, because once they are going low on stocks and the RMS hasn't yet reached them, they are confident that Zipline will fill in the gap for them.
The centers that have put is also serving as warehouse storage places for us. Our vaccine storage system is not very strong. They are now storing some of our vaccines and blood in their warehouses that have cold stores, because we store medicines there for emergency deliveries. And these are areas that we are now utilizing as part of our supply chain system. And it's phenomenal.
The team here is preparing to fly a few more drones to some of the 350 health facilities they serve. This drone is on its way to Akwadum Health Center, which is almost an hour drive from the Omenako Zipline office. These drones are on their way to deliver critical health products.
So the facilities request for vaccines for the immunization campaigns that they do. They also request for anti-rabies, anti-snake during emergencies. They also request for anti-malarial medications and also infusions as well. But because of the nature of our operation, we are better placed to be able to serve at speed the anti-snake and anti-rabies more, because those are things that you need quickly and the patient will need it. And in a matter of seconds, the patient may lose their life, so we are better placed to be able to serve those. So we get quite a number of those orders.
At Akwadum, while waiting on this pack, we saw the drone in the skies. In no time, it was ready to deliver the package. Dennis Ni Alote is a community health nurse here.
Before Zipline, we used to order drugs from the medical stores, and when it's finished or depleted, we need to use the motorbike to town or to our district and order for more drugs. For emergency drugs, sometimes it might not be available, so you need to refer them to Koforidua Regional Hospital. But for the help of Zipline, now we don't usually do the referral. If you can get the drugs from them, that is if they have in stock those drugs. So we just order those medications, and within 10 to 15 minutes, it's available when we administer.
Dennis is happy with the intervention of this technology, especially in the area of maternal health.
In the labor ward, sometimes you may have complicated cases in the middle of the night or maybe early in the evening, that it might not be advisable to refer due to the condition of the patient. So we usually make a fast request to Zipline, and like I said, between 10 to 15 minutes it's been delivered and we are good to go. So they've been of tremendous help to us. So.
The physician assistant here, Jeffrey Tinkorapa, has also relied on the drones to save lives.
We had a case that we need an injection to give. There was a case of a pregnant woman who came in, vomited successfully. So we are lack of injection metoclopramide, so we demand for it. There was another case that came with severe abdominal pain as well as diarrhea. So we needed an injection Buscopan. We requested for it. If the person is vomiting is so severe, he's going to lose a lot of body electrolytes, and so you must get it. Although while we are giving infusion, you must look for a way to stop the vomiting. And in the case of the patient coming with severe abdominal pain, which we needed that as a form of antispasmodic with the Buscopan, it's mean we have to do it just to help reduce the pain, and then whatever medication that we need to eat to add, we could go along with it. That is why we needed it, and since we've run out of it, that's the reason why we have to demand for it. And fortunately, Zipline was able to buy it on time for us.
So pregnant women, one in Talensi, I remember, who was saved because they just were able to deliver blood to Talensi. Otherwise, the patient would have had to be moved to Bolga Hospital. And you know, when it's pregnant women who's bleeding after delivery, you have on average about 2 hours to survive, and so every minute counts.
A lot of people didn't understand what it was that we were going to do. The opposition was shouting, this won't happen, the drones will be this. So we fought the battle. And again with prayers and some good explanations and courage with the support from our hierarchy, the president and the vice president. When they are supporting you, you go with confidence, you know. So we got these things passed through Parliament, and what the vice president said was that we're not going to use government money because opposition were shouting, blah, 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 blah. We managed to get it through Parliament approved, so we started implementation.
For the vice president, envisaging such a relief to people was the motivation to introduce the drone technology in spite of the strong opposition.
Unfortunately, when we brought up the idea of Zipline, there was a lot of opposition because many people didn't understand it. People thought that the Zipline was going to go around taking pictures of people in their bathrooms, you know. But today, the doctors, the nurses, because if you're a doctor or you're a nurse and you are in a place and you are watching your patients die because you can't have access to blood or some critical medicine, it's very, very disheartening for any medical practitioner. But with Zipline, you, at least for the areas that are being covered, you are just a phone call away and the medicine will be dropped right at your clinic.
The boxes for packaging the drugs have been carefully designed.
Our drones do not land. So the drones, once they get to the location, they drop the package. The package hits the ground. So this is what the package looks like. It carries a weight of approximately 2 kilos, and then it has a parachute on top of it. The parachute is supposed to allow the box to drop in a more, a much easier fashion, so that there isn't any hard hit to the ground. And then every box also has an air insert in there, which is supposed to act as a shock absorbing material, so that once it hits the ground, there isn't any damage to any product. And then every package that we have in here also has a unique barcode, the unique number. And so for the purposes of traceability, once we send a package to any facility, we always know that this particular package went there, it dropped at this particular time, this particular drone took it there. And so we have all that data available for the work that we do.
In all their centers, Zipline has given the box making contract to people from the communities. It is their way of creating jobs to boost the local economy. As the community lead responsible for community integration at VOPSI, Simon Asino tells us they even go beyond this.
All of these has been assembled by local employees. So everywhere that we go to, we make sure that we employ local people and then we train them to be able to assemble these boxes. This contributes to the creation of employment around the communities where we serve. Beyond that, we also believe in the economic empowerment of local vendors. And so at Zipline, we care so much about our staff that we do not want service interruptions. And so we ensure that every staff member gets 3 meals a day. And so we've been able to outsource that aspect of the work to local vendors, and we have 3 vendors who supply us food every 2 weeks, and then another vendor comes on board. Outside of that also, we have certain types of works, menial construction works around, and then which we always outsource to local contractors to come on board. All of this, we believe that we actually devolving opportunity down to the local community members and also empowering them economically to be able to create wealth for themselves.
Their impact was felt more, especially in the heat of the COVID-19 pandemic.
With COVID, the drone started flying samples from the hinterlands to Omenako, and from there continued by road to Noguchi, so that they could test in good time to take results back. Phenomenal.
For doctors and their nurses, their joy is from the fact that referrals to bigger facilities have reduced.
For example, if you are in somewhere in Sefiyo or so, or in Western North, and it takes you about 2-3 hours to transfer a patient from one place to another because the person needs blood. If the drone is able to deliver blood in 30 minutes, that means that you really don't have to. People just refer because we don't have this medication or we don't have this, and they transfer. So with the improvement in supplies, and even where they don't have, they're able to deliver in a short time, it's still faster than having to move a patient. So that has significantly improved care.
Especially with the blood products, with vaccines, let's say immunoglobulins, Hep B immunoglobulin, you want something you are not able to access immediately. Once you call Zipline, they are able to send it to you, and then you can use it for your patient, whether it's an urgent need for a product or it's something that can wait. Zipline will still be able to deliver it on time. So when they do that, you no longer have need to refer such patients. So it has really helped in reducing the number of referrals that we send.
Now you see that the people in the community do not actually have to travel out, because they know that when they go to the facility and the facility doesn't have the product, the small drone will come and deliver the product that they need for them to get their health needs actually attended to.
There are plans for the drone service to cover the entire country.
We are hoping that next year we will have coverage for the whole of Ghana. Right now we have 4 main centers. We need an additional 4 centers for 100% coverage of all of Ghana, and I think it's very, very important. And I hear a parliamentarian, in fact, made that request that we should get coverage for all of Ghana. And he wasn't an MPP parliamentarian, he was an NDC parliamentarian. And it's good that that thinking has changed about how helpful the drones have been. We are at a cutting edge of technology, and Ghana is one of the leading countries in the world